Question 1. A nurse enters a client's room and notices smoke coming from a trash can. What is the nurse's first action? A. Pull the fire alarm. B. Remove the client from the room. C. Attempt to extinguish the fire. D. Close the room door. Correct answer, B. Remove the client from the room. Rationale. In a fire emergency, the nurse follows the RACE protocol. The first priority is rescuing clients from immediate danger. Strategy. Remember RACE equals rescue, alarm, contain, extinguish/evacuate. Question 2. A confused client attempts to climb out of bed repeatedly. Which intervention is best? A. Apply wrist restraints immediately. B. Raise all 4 side rails. C. Place the client near the nurse's station. D. Administer a sedative medication. Correct answer, C. Place the client near the nurse's station. Rationale. Close observation is the safest and least restrictive intervention. Strategy. Always choose the least restrictive safety measure first. Question 3. Which client is at highest risk for falls? A. A 25-year-old postoperative client. B. A 40-year-old with pneumonia. C. An 82-year-old taking diuretics. D. A teenager with appendicitis. Correct answer, C. An 82-year-old taking diuretics. Rationale. Older adults using diuretics have increased risk for dizziness and urgent toileting needs. Strategy. Elderly plus medications affecting balance equals high fall risk. Question 4. A nurse prepares to transfer a client from bed to wheelchair. Which action promotes safety? A. Keep the wheelchair unlocked. B. Bend at the waist during lifting. C. Lock the wheelchair brakes. D. Place the wheelchair far from the bed. Correct answer, C. Lock the wheelchair brakes. Rationale. Locked brakes prevent movement during transfer and reduce injury risk. Strategy. Always stabilize equipment before moving a client. Question 5. Which action by the nurse requires immediate intervention? A. Using 2 identifiers before medication administration. B. Wearing gloves during wound care. C. Recapping a used needle with 2 hands. D. Disposing sharps in a sharps container. Correct answer, C. Recapping a used needle with 2 hands. Rationale. Recapping needles increases needle stick injury risk. Strategy. Never recap used needles unless absolutely required. Question 6. A client with seizures is admitted. Which equipment should the nurse place at the bedside? A. Oxygen and suction equipment. B. Restraints. C. Heating pad. D. Walker. Correct answer, A. Oxygen and suction equipment. Rationale. Airway management is essential during seizure activity. Strategy. For seizures, think airway and protection first. Question 7. Which client should the nurse see first? A. Client with blood pressure 118/70 mmHg. B. Client requesting pain medication. C. Client with sudden chest pain and shortness of breath. D. Client waiting for discharge teaching. Correct answer, C. Client with sudden chest pain and shortness of breath. Rationale. Chest pain and dyspnea may indicate life-threatening complications. Strategy. Use ABCs, airway, breathing, circulation. Question 8. A nurse is caring for a client receiving oxygen therapy. Which safety precaution is priority? A. Keep petroleum jelly nearby. B. Place candles in the room. C. Post no smoking signs. D. Turn off humidification. Correct answer, C. Post no smoking signs. Rationale. Oxygen supports combustion and increases fire risk. Strategy. Oxygen equals fire hazard precautions. Question 9. Which finding indicates proper use of restraints? A. Tying restraints to side rails. B. Removing restraints every 2 hours. C. Applying restraints without an order. D. Securing restraints tightly. Correct answer, B. Removing restraints every 2 hours. Rationale. Restraints require regular assessment and release to prevent injury. Strategy. Safety restraints must still protect circulation and dignity. Question 10. A nurse discovers a client lying on the floor. What is the first action? A. Help the client back to bed. B. Complete an incident report. C. Assess the client for injuries. D. Notify the provider. Correct answer, C. Assess the client for injuries. Rationale. Assessment comes before moving the client. Strategy. Assess first before intervening. Question 11. A nurse prepares to administer blood. Which action is essential? A. Check blood with another licensed nurse. B. Warm blood in a microwave. C. Infuse with dextrose solution. D. Shake the blood bag before use. Correct answer, A. Check blood with another licensed nurse. Rationale. Verification reduces transfusion errors. Strategy. Blood administration requires strict identification checks. Question 12. A nurse cares for a client with impaired mobility. Which intervention prevents pressure injuries? A. Massage reddened areas. B. Reposition every 2 hours. C. Keep the head elevated continuously. D. Use donut-shaped cushions. Correct answer, B. Reposition every 2 hours. Rationale. Frequent repositioning decreases prolonged pressure. Strategy. Turn schedules protect skin integrity. Question 13. Which action by the nurse prevents medication errors? A. Administer medications quickly. B. Skip client identification if familiar. C. Follow the rites of medication administration. D. Leave medications at bedside unattended. Correct answer, C. Follow the rites of medication administration. Rationale. Medication rites reduce administration errors. Strategy. Slow and accurate is safer than fast. Question 14. A client suddenly begins choking during meals. What is the priority nursing action? A. Offer water. B. Perform abdominal thrusts. C. Encourage deep breathing. D. Lay the client flat. Correct answer, B. Perform abdominal thrusts. Rationale. Abdominal thrusts help dislodge airway obstruction. Strategy. Airway obstruction equals immediate emergency response. Question 15. Which client requires contact precautions? A. Pulmonary tuberculosis. B. Influenza. C. Methicillin-resistant Staphylococcus aureus, MRSA. D. Meningitis. Correct answer, C. Methicillin-resistant Staphylococcus aureus, MRSA. Rationale. MRSA spreads through direct contact. Strategy. No isolation categories for infection control. Question 16. A nurse is teaching crutch walking. Which statement shows understanding? A. I will support weight under my arms. B. I should look down while walking. C. I will move the crutches before stepping. D. I should wear slippery shoes. Correct answer, C. I will move the crutches before stepping. Rationale. Correct crutch sequence promotes balance and safety. Strategy. Assistive devices require coordination and posture. Question 17. Which client is at greatest risk for aspiration? A. Client with broken leg. B. Client with dysphagia after stroke. C. Client with dermatitis. D. Client with migraine headache. Correct answer, B. Client with dysphagia after stroke. Rationale. Swallowing impairment increases aspiration risk. Strategy. Stroke plus swallowing problems equals aspiration precautions. Question 18. A nurse notices electrical equipment with a frayed cord. What should the nurse do? A. Tape the cord. B. Continue using it carefully. C. Remove the equipment from service. D. Ask the client to avoid touching it. Correct answer, C. Remove the equipment from service. Rationale. Damaged electrical equipment poses shock and fire hazards. Strategy. Unsafe equipment should never remain in use. Question 19. Which intervention best prevents postoperative deep vein thrombosis? A. Bed rest. B. Encourage leg exercises. C. Limit fluids. D. Keep legs crossed. Correct answer, B. Encourage leg exercises. Rationale. Movement promotes circulation and reduces clot formation. Strategy. Immobility increases clot risk. Question 20. A nurse caring for a visually impaired client should: A. Rearrange furniture frequently. B. Leave objects on the floor. C. Identify self when entering the room. D. Speak loudly at all times. Correct answer, C. Identify self when entering the room. Rationale. Consistent communication promotes orientation and safety. Strategy. Support independence while reducing hazards. Question 21. A nurse finds a client unresponsive. What is the first action? A. Call the family. B. Check for responsiveness and breathing. C. Obtain vital signs later. D. Document the event. Correct answer, B. Check for responsiveness and breathing. Rationale. Immediate assessment determines need for CPR. Strategy. Assess before activating further interventions. Question 22. Which statement about infection control is correct? A. Hand hygiene is optional with gloves. B. Gloves replace hand washing. C. Hand hygiene is the best method to prevent infection. D. Masks are required for all clients. Correct answer, C. Hand hygiene is the best method to prevent infection. Rationale. Hand hygiene remains the most effective prevention method. Strategy. When unsure, prioritize hand washing. Question 23. A nurse is positioning a client after a lumbar puncture. Which position is best? A. High Fowler's. B. Trendelenburg. C. Flat or prone. D. Sims position. Correct answer, C. Flat or prone. Rationale. Flat positioning decreases spinal headache risk. Strategy. Remember post-lumbar puncture headache prevention. Question 24. A nurse delegates ambulation of a weak client to an assistive personnel. Which instruction is priority? A. Walk quickly. B. Use a gait belt. C. Keep side rails raised afterward. D. Leave the client alone afterward. Correct answer, B. Use a gait belt. Rationale. Gait belts improve stability during ambulation. Strategy. Safety equipment reduces injury risk during mobility. Question 25. A child is admitted after accidental poisoning. Which action is priority? A. Determine the substance ingested. B. Offer milk immediately. C. Induce vomiting. D. Delay treatment until parents arrive. Correct answer, A. Determine the substance ingested. Rationale. Treatment depends on the ingested substance. Strategy. Assessment guides poison management. Question 26. A nurse receives a medication prescription that seems unusually high. What should the nurse do? A. Administer it quickly. B. Clarify the prescription with the provider. C. Ignore concerns. D. Ask another client. Correct answer, B. Clarify the prescription with the provider. Rationale. Questioning unusual orders prevents medication errors. Strategy. If something seems unsafe, verify it. Question 27. Which client should be placed in airborne precautions? A. Client with measles. B. Client with wound infection. C. Client with C. difficile. D. Client with hepatitis A. Correct answer, A. Client with measles. Rationale. Measles spreads through airborne particles. Strategy. Airborne diseases require special respiratory protection. Question 28. A nurse is teaching home fire safety. Which statement requires correction? A. I will keep matches away from children. B. I should test smoke alarms regularly. C. I can overload electrical outlets safely. D. I need a fire escape plan. Correct answer, C. I can overload electrical outlets safely. Rationale. Overloaded outlets increase fire risk. Strategy. Electrical safety is a common Nclex focus. Question 29. Which intervention decreases risk of catheter-associated urinary tract infection? A. Disconnect tubing frequently. B. Keep drainage bag below bladder level. C. Raise drainage bag above bladder. D. Use sterile gloves only during removal. Correct answer, B. Keep drainage bag below bladder level. Rationale. Proper drainage prevents urine backflow. Strategy. Think gravity flow for urinary drainage systems. Question 30. A nurse enters a room and observes water on the floor. What is the priority action? A. Ignore it temporarily. B. Clean the spill immediately. C. Notify housekeeping later. D. Place equipment over the spill. Correct answer, B. Clean the spill immediately. Rationale. Wet floors increase fall risk. Strategy. Environmental hazards require immediate correction. Question 31. A nurse is caring for a client with hearing impairment. Which action improves safety? A. Approach from behind. B. Speak while facing away. C. Face the client when speaking. D. Shout instructions loudly. Correct answer, C. Face the client when speaking. Rationale. Visual cues improve communication. Strategy. Support sensory deficits with adaptive communication. Question 32. A client receiving opioids becomes difficult to arouse. Which assessment is priority? A. Bowel sounds. B. Respiratory rate. C. Skin color. D. Appetite. Correct answer, B. Respiratory rate. Rationale. Opioids can cause respiratory depression. Strategy. Respiratory status is priority with opioids. Question 33. Which finding suggests elder abuse? A. Controlled blood pressure. B. Multiple bruises in various healing stages. C. Gray hair. D. Poor appetite occasionally. Correct answer, B. Multiple bruises in various healing stages. Rationale. Inconsistent injuries may indicate abuse. Strategy. Unexplained injuries should raise concern. Question 34. A nurse prepares a sterile field. Which action contaminates the field? A. Keeping the field above waist level. B. Turning away from the field. C. Opening sterile packages away from the body. D. Keeping objects dry. Correct answer, B. Turning away from the field. Rationale. A sterile field must remain in constant view. Strategy. Out of sight equals contaminated. Question 35. A nurse is transporting oxygen cylinders. Which action is correct? A. Roll cylinders on the floor. B. Secure cylinders upright. C. Store near heat sources. D. Leave uncapped cylinders. Correct answer, B. Secure cylinders upright. Rationale. Proper storage prevents accidents and explosions. Strategy. Handle oxygen tanks carefully and securely. Question 36. Which action by an assistive personnel should the nurse correct? A. Washing hands before care. B. Using gloves appropriately. C. Leaving bed in high position after care. D. Reporting abnormal findings. Correct answer, C. Leaving bed in high position after care. Rationale. Bed should remain in the lowest position to prevent falls. Strategy. Low bed equals safer environment. Question 37. A nurse is caring for a suicidal client. Which item should be removed from the room? A. Tissues. B. Plastic utensils. C. Call bell. D. Shoelaces. Correct answer, D. Shoelaces. Rationale. Potential ligature items increase suicide risk. Strategy. Remove anything that can cause self-harm. Question 38. A nurse is preparing a client for surgery. Which action is priority? A. Remove jewelry. B. Offer heavy meals. C. Apply lotion to surgical site. D. Delay consent verification. Correct answer, A. Remove jewelry. Rationale. Jewelry may cause burns or circulation issues during surgery. Strategy. Preoperative safety reduces complications. Question 39. A nurse notices smoke from an electrical outlet. What should the nurse do first? A. Pour water on the outlet. B. Disconnect power if safe. C. Ignore the smoke. D. Open windows widely. Correct answer, B. Disconnect power if safe. Rationale. Electrical fires require removal of the power source. Strategy. Never use water on electrical fires. Question 40. Which intervention helps prevent infant abduction in hospitals? A. Allow unrestricted visitors. B. Use identification bands. C. Leave infants unattended. D. Transport infants without bassinets. Correct answer, B. Use identification bands. Rationale. Matching ID bands improve infant security. Strategy. Security measures protect vulnerable clients. Question 41. A nurse cares for a postoperative client. Which finding requires immediate action? A. Pain score 4 out of 10. B. Oxygen saturation 86%. C. Temperature 37 degrees Celsius. D. Mild nausea. Correct answer, B. Oxygen saturation 86%. Rationale. Low oxygen saturation indicates impaired oxygenation. Strategy. Airway and oxygenation problems are priority. Question 42. Which client is at greatest risk for pressure injuries? A. Ambulatory teenager. B. Immobile older adult. C. Client with seasonal allergies. D. Client with mild headache. Correct answer, B. Immobile older adult. Rationale. Immobility and aging increase skin breakdown risk. Strategy. Pressure injuries develop from prolonged pressure. Question 43. A nurse teaches a client about walker safety. Which statement shows understanding? A. I will pull the walker behind me. B. I should wear non-skid shoes. C. I can lean far forward. D. I will climb stairs with the walker first. Correct answer, B. I should wear non-skid shoes. Rationale. Non-skid footwear decreases fall risk. Strategy. Safe footwear is essential with mobility aids. Question 44. A nurse is disposing of contaminated dressings. Which action is correct? A. Place in regular trash. B. Use biohazard disposal. C. Leave at bedside. D. Flush down the toilet. Correct answer, B. Use biohazard disposal. Rationale. Contaminated materials require proper disposal. Strategy. Follow infection control disposal policies. Question 45. A nurse is teaching about carbon monoxide poisoning prevention. Which statement is correct? A. Carbon monoxide has a strong odor. B. Generators can safely run indoors. C. Install carbon monoxide detectors. D. Open flames reduce carbon monoxide. Correct answer, C. Install carbon monoxide detectors. Rationale. Carbon monoxide is odorless and dangerous. Strategy. Detector installation saves lives. Question 46. Which intervention is safest for a client with osteoporosis? A. Encourage high-impact jumping. B. Remove loose rugs from the home. C. Recommend slippery footwear. D. Limit calcium intake. Correct answer, B. Remove loose rugs from the home. Rationale. Fall prevention is essential for fragile bones. Strategy. Home safety reduces fracture risk. Question 47. A nurse is caring for a client during a tornado warning. Where is the safest place? A. Near windows. B. Elevator area. C. Interior hallway away from windows. D. Rooftop. Correct answer, C. Interior hallway away from windows. Rationale. Interior protected areas reduce injury risk. Strategy. Avoid windows during severe storms. Question 48. A nurse notes a client has a latex allergy. Which item should be avoided? A. Vinyl gloves. B. Latex urinary catheter. C. Cloth gown. D. Plastic stethoscope. Correct answer, B. Latex urinary catheter. Rationale. Latex exposure can trigger severe reactions. Strategy. Identify hidden latex-containing items. Question 49. A nurse prepares to administer enteral feeding. Which action prevents aspiration? A. Lay the client flat. B. Check gastric residual and elevate HOB. C. Infuse rapidly. D. Use cold formula directly from refrigerator. Correct answer, B. Check gastric residual and elevate HOB. Rationale. Head elevation reduces aspiration risk. Strategy. Enteral feeding safety focuses on airway protection. Question 50. A nurse notices a visitor attempting to give a client unknown pills. What should the nurse do first? A. Ignore the situation. B. Assess the medication before administration. C. Allow the visitor to continue. D. Document after the visitor leaves. Correct answer, B. Assess the medication before administration. Rationale. Unknown medications may harm the client or interact dangerously. Strategy. Verify all substances before client use.